You need protective glasses.
All right, protective glasses. Yes, let's begin from there. Caring for the eyes is what we're talking about this morning. And many people do not know. Like people like me say, oh, you do me. I see far, I see near, I see everything. But I do this job.
That's what you think.
You see the problem?
That's what you think.
So we have this misconception that we are fine.
Exactly.
We're perfect.
Exactly. Thank you for bringing me here. And I'm happy we are starting from, your observation of the fact that you can see far, you can see near, you can see everything. And so you feel your eyes are good, your eyes are okay.
Yeah.
But I'm here to debunk that myth today. That the fact that you can read your books, the fact that you can see what is far or you can see what is near does not necessarily mean your eyes are good. Or they are okay. Eye care or caring for the eyes goes beyond just seeing what is far or what is near. I'm a doctor of optometry. I have a PhD in public health, and by virtue of the work that I do, I've been
she has a PhD.
My God. Thank you so much.
Yeah.
So
you're a double. So we should actually write your name as, please. This is the way you write her name. You do, Dr. Priscilla.
You don't have to do that.
Imade. You now put MD at the back, or you put PhD at the back, so that we can write it properly. And me, let's fuel ourselves this one.
Thank you so much. I appreciate you. So by virtue of the researches I do and what is on ground by the World Health Organization and so many international agencies, we have come to realize that the measurement of vision and having perfect eyes, it's a far cry from what people generally believe. Now, some people can see what is far, they can see what is near, and they feel that they are okay. But you have seen, certain cases where at some point the person suddenly realizes that he can no longer see or there's a problem. Meanwhile, these problems have been there. But because the person was still able to see, or in his own assessment, he felt his vision is okay, he didn't know that there was a problem. For example, glaucoma. Many people who are blinded from glaucoma today did not know ab initio that they had glaucoma. So they see far, they read, then all of a sudden they realize that these functions just become suddenly hampered. Also, poor vision. There's a way we measure how well you can see. When you come to the clinic, for example, we ask you to read the distance chart that we call the Stelly chart. We give you the ABCD. I don't know if you've done an eye test. Maybe you understand what I'm saying.
Never.
So when you read your ABCDs and we have pass mark. So for some people, they may not meet up with that 20/20 vision or the 6/6 vision. Some of them could have like a 6/12 vision or even a 6/18 vision. But in their own estimation, because they cannot know what the pass mark is, or they are still able to carry out their daily activities, they feel their vision is okay. And then the fact that they can read their books, they also feel their vision is okay. But when you also come, we take the measurement of how well you can read. So we assess what you are reading. Is it in tandem with your age? It's just like when you are in school. There are students, you grade the student. If you have an A, we say, okay, maybe when you have 80 and above, you have A. You have 70 and above, you have A. You have 60 and above, you have.
So that's also the way.
Yes, we grade division. Some people could have a 40%, and we say, okay, it's a pass. And the person is happy, so I just passed. But we know, in the real sense of it,
the person
that it's
just
pass. Let my people go. You can move on, but you can do better. So many people have that kind of vision without knowing. So until you come for an eye examination, you may not know if your vision is adequate for your age, for the job you are doing, and generally if you are developing any eye problem. Also, in line, with that, until you come for an eye examination, it will be difficult for you on your own to assess yourself and say your vision is okay, because the eye does not see itself. You can only know how good or how perfect, so to speak, your vision is only when you come for an eye examination.
So we cannot, we think we can measure. All of us, we used to measure. I can read what I'm reading yesterday. I can read what I read 2 days ago.
Fine. See, like glaucoma that I mentioned earlier, many a time, the symptoms from glaucoma are not really visible to the person, and there may be no symptom at all. There can be, structural damages in the eye without maybe a change in function. Glaucoma actually starts eating up the vision from the periphery, and the person may not know, because you are looking straight, you can see, and then if you really can't see things very well from your side, you may just turn your head and you are seeing it. So you may not know that there is a difference between the use of your peripheral vision and your central vision.
Are you kidding me? So there is
there's a lot, of course, and then sometimes the two eyes may not even be moving properly, but you may not know. Some children are even short-sighted. They may not even know that they are short-sighted until they enter school, or until they can no longer see what is on the board very well. I've had people come to me maybe at the age of 40, 50, and they're like, I've never done an eye examination. And when we find out they are short-sighted, and said, oh, how have you been coping? Say, oh, I just moved to what I want to read. Or some will say, I didn't even know that I'm expected to read something as far as 6 meters, or to such an extent.
Are you serious?
Of
so
course,
you're meant to be able to read as far as 6 meters?
6 meters at distance.
But you see, the fear for most people when they go for eye examination is that they will come back and then you will give them glasses and then their eyes will begin to sink
that's
inside.
That's a myth. Yes, I get that response quite a number of times.
People don't want to wear glasses because their eye, that's what we're told now, that your eye will sink inside.
It's a myth.
Okay.
Now let me explain it this way. Now, when you come for an eye examination, we have 3 ways of correcting your visual problems. We can give you glasses, we can give you medications, it can be surgery, it can even be counseling. Sometimes the kind of things you do can actually hamper your vision or impair your vision. Just mere counseling, okay, this is what you should do, this is how you should position your book when you want to read, this is the kind of food you should eat, can actually help your vision. Then if there's need to wear glasses, the one that people complain that, when you wear the glasses, the eyes look sunken. Does my eye look sunken now? No, it's a kind of,
it looks like fashion glasses.
Thank you. So you see, like people who are short-sighted, for example, because they are concave lenses, if the prescription is a bit high and you look in through the glasses, the eye will appear sunken. That's what people actually complain of, but it's not always the case.
Yes.
And now there are newer technologies that can actually reduce the size of your lenses, so that no matter how thick your prescription is, it can actually come out cosmetically fine. So people shouldn't just have that belief that anytime they come for an eye examination, it must end in glasses. No, it's not always so. Okay, and then
I get it.
Okay, I'm also going to say that for caring for your eyes, as we start in the new year, the first thing we should do is have a comprehensive eye examination. Now, as a researcher in this part of the world, I have found out that many of us rarely take the initiative to take care of our eyes. Many people rarely go for an eye examination until they have a problem with their eyes. That's not how it should be. That's not the way to go. You know why? Because many of the problems that will be debilitating on the eye will not blow a whistle. You may not know. And if you don't go for eye checkup, you won't know that problem is there.
Actually exists.
I've had people, I'm also a Christian by the grace of God. I've had people who come to me and say, oh, this is a witchcraft attack, this is a spiritual attack, and things like that. And by the time I examine the eye, I realize that, this person must have had glaucoma for like 5-10 years without knowing. And then the person sleeps and wakes up and is blind, and he says this one person because he traveled to the village and he came back and this happened and another happened. You see, so having a comprehensive eye examination, number one, will make you to know the status of your eye health. Just like you go for your yearly routine medicals. As human beings, we need to understand ourselves. You need to understand your visual status, your eye status. It's just like if I ask you now, what is your genotype? What is your blood group?
I'm supposed to naturally know.
Of course. The same thing about the eyes. If I ask you what is your eye pressure, okay, how good is your eyes, and what is your visual acuity? Some of these factors about your eye,
you're supposed
to know. So
the way I know the measurement of my body.
Exactly. Your shoulder is this, your waist is this, and you're supposed to know. So if you don't go for an eye examination, how will you know that? So begin the year with a comprehensive eye examination. Know your visual status.
Let me take this call. Hello, good morning.
Good morning.
You're joining us from where, and your name, sir?
My name is Amodu Abidemi.
Where are you calling from? Please turn down the volume of your TV.
Okay.
The volume of your
Sorry,
TV,
sorry.
please.